because if it gets to 1.0, then unless there's an influx of new positive cases from out of the area, it will eventually die out. And the data presented today has Kansas as the 7th best state in the country with an R sub naught of 0.87. Now, 0.87 is less than 1, which means that if we are able to maintain our vigilance, that this will die down to, in theory, 0, unless there's an influx of cases from outside of the area. This is a spectacular result for Kansas. And I applaud the people who are showing great discretion in pushing it down, but we must remain vigilant to keep it on that same trajectory. Cluster information. We have currently recorded 122 clusters, 47 of which are closed and 47 of which are closed, yes, and 75 of which are active, accounting for 4,981 of the cases and 141 deaths. So in other words, about half of the cases and over half of the deaths. Corrections, which by the way has a lot of good news about it. 3 clusters, 991 cases and 6 deaths. We just, the last day or so, did an additional cohort testing of previously negative people in the offender population who have retested, and it's down to 3.7 positive cases per 100. And that, you'll recall that they were at 50 to 75% of asymptomatic people were showing positive test results even 3 or 4 weeks ago. Kudos to the Department of Corrections, and thank you to my staff members who have been diligent about being there, because again, yes, the offender population, but we must also protect our staff because they need to be protected and they live in the community. Spectacular. Gatherings, 12. Clusters, 7 are closed, 143 cases and 11 deaths. Group living arrangement, 6 clusters, 4 of which are closed, 52 cases and 2 deaths. Healthcare, 5 clusters, 4 of which are closed with 44 cases, no deaths. Long-term care, 30 clusters, 13 are closed with 690 cases and 109 deaths. That's obviously the largest population of people who are deceased from this in a particular type of cluster. Meatpacking, 10 clusters, 2,647 cases and 9 deaths. Similarly, they're having a lower and lower percentage of positives all the time. Private industry, 56 clusters, 19 are closed with 414 cases and 4 deaths. Mass gatherings. I want to note that included in this week's clusters are several new ones related to mass gatherings. These include outbreaks stemming from funerals, Mother's Day gatherings, and a keg party. Mother's Day was May 10th, and this serves as a reminder that the incubation time of this virus is likely, and we're coming to the end of that 2-week period, obviously, from the Mother's Day on the May 10th. But it serves as a reminder that anytime there's an event that naturally causes people to gather, we have to be particularly vigilant to not allow it to spread. Just because you might feel okay today doesn't mean it's safe to be congregating in large numbers. So remain vigilant. The virus has not gone away, and there is no vaccine available. And I've said before, and I'll say it again, and I'm sure I'll say it again, you are your own preparedness. Reopening. As counties work to reopen, I've been encouraging county health officers and elected officials to refer to the Ad Astra reopening plan related to public health recommendations. The plan, while unfortunately is now only guidance, was put together with the health and safety of Kansans in mind. The principles and data driving the plan are proven and are working well, as you've heard me comment earlier during this briefing. I'd like to pivot for just a moment to a topic that has been weighing heavily on my mind. I know that of the governor and all of us. As things begin to reopen, it is important to make note of what we've been through and what lies ahead. This is not over and will not be for some time. It has impacted us as adults, and it's impacted our kids. I'd like to read you part of a letter a mother wrote to me just this past week. Quote, "Is there any chance that you would consider speaking directly to our young people or personally addressing the teenagers in Kansas for their bravery and fortitude? We have a 16-year-old. She is really struggling emotionally. She has followed all the guidelines," which I might make a side note, that's surprising for a teenager and quite credible. But she has been following all the guidelines that we have given and we have enforced social distancing, and she has a new medical condition. So, as you might imagine, she was already feeling on lockdown as we adjusted her medicines and figured out how she could safely participate in school and dance. This Memorial weekend, last weekend, she was so sad, crying, and feeling so restricted that she needs some encouragement to somehow stay the course, as you have continued to say is so vitally important. She sees little hope or light at the end of the tunnel. She would like to be able to socialize with at least one friend personally, and we have not allowed that kind of personal contact at other people's homes or ours, with the exception of offering to her the option of meeting outdoors at a distance. Could you possibly address in a letter or in a televised update what you are seeing from some teenagers that are truly positive in terms of making their choices and how teenagers should stay the course? For us parents, having guidelines related to the teen choices and socialization would be helpful. They need to boost somehow, but we do not want to go backwards as we open up the socialization floodgates," unquote. Excuse me. As a parent and grandparent, this breaks my heart to hear this kind of story. For teens who are struggling right now, and anyone struggling, we see you. We care about you, and we really understand how difficult this is. It is because of the diligence you described and the precautions you and your family are taking that we have been able to flatten the curve thus far. Thank you for your bravery. I also know that whatever actions your county takes in the days and weeks ahead might be different. There might be different rules and guidelines that have been set out by your particular county for, in this case, this family and their daughter to protect themselves and their community. I want to remind you that, as I have said earlier, even in this briefing, that you are your own preparedness. Please continue the public health measures that have been put in place, such as mask wearing, social distancing, hand washing. We know this is hard and that maintaining positive mental health during COVID-19 can be difficult. We encourage teens and adults to stay connected and ask for help if needed. Talk with families, friends, and coworkers about how you are feeling. You know, teenagers oftentimes fight with their parents and want to be rebellious and separate from them. And nothing is more important than their peers, oftentimes as teenagers. So I really think that we do need to be attentive to the fact that at a time when they're struggling with autonomy and independence away from their parents, and yet they're not with their peers and their friends, they are going to struggle. And I think we're starting to see that now. If your stress impacts your daily activities for several days in a row, or if you'd like to talk to a professional, there are resources out there. Text here in Kansas to 741-741 to reach a crisis text line. Kids and young adults are very inclined to text, and I would remember that number, 741-741. The National Suicide Prevention Lifeline is at 800-273-8255, which is in English, or 888-628-9454 for Spanish. And then finally, find treatment at SAMHSA, which is find treatment, one word, .samhsa.gov. Those are all resources that a young person can address and to access directly. Again, to anyone struggling, we see you, we care about you, and we understand, we would be happy to help you find the resources necessary to access the care you need. And again, to all of you, thank you so much for your part to help Kansas stay healthy. That's the end of my prepared remarks. Happy to answer questions.
Yes, Dr. Norman. Several large counties, Wyandotte County, Sedgwick County, Johnson County are allowing a lot of businesses to reopen, particularly bars and nightclubs. The Old Town District in Wichita is advertising that it's going to be open. In addition to that, there's a big youth baseball tournament in, I think, Lenexa this weekend. What do you think of all that?
I think that mass gatherings that are in exceedance of the ad astra reopening plan are ill-advised, quite honestly. And I think that we're going to continue with the opening and reopening plan as is, advising it with our metrics. And we think that if the officials feel that it's safe to reopen in their counties, we would still hope that people can vote with their feet. Essentially, if people want to go, they're going to go. But we would hope that they would pay it and give attention to those metrics, give attention to the reopening plan, and follow it. And I would hope that parents would give young people guidance, and that they would accept that guidance for themselves when it comes to bars and things that are inherently unsafe, because this virus is still out there, I assure you.
Well, but the argument, I think, would be you can take steps with social distancing. For example, at a baseball tournament, they're outside. And of course, baseball, most of the time, if you're not on the bench, you're some distance from another player. I usually would be way out in right field.
Yeah, you're way out in left field, but that's good.
No, always right field. That's where the weakest player plays.
Oh, I got you. Okay.
But my question for you is it advisable even, are you saying that's ill-advised too? You wouldn't hold a big youth baseball tournament?
No, if there's activities that are outside that are in keeping with the mass gathering numbers and the amount of social distancing, and if you have control of your environment and you're not going to be close to anybody that's coughing or sneezing, that kind of thing, then I think that is in keeping with the reopening plan. I go outside myself without a mask on, but it's in an area where I'm in control and I don't have the risk around me of people that are enclosed, and particularly not in an enclosed space. So I think that, again, we're trying to propagate principles to adhere by, not necessary rules.
But by that logic, until there's a vaccine, really, it's not safe to go back to bars and nightclubs.
By that logic, that's absolutely true.
So you would not be reopening bars and nightclubs at this
Not at this juncture, no.
So this has kind of come up. You used the word unfortunately, I think at one point about talking about some of these plans to reopen. Did you advise the governor not to back off the statewide restrictions then, that, not to make her ad astra plan advisory? Was that your advice to her before she did that?
My advice to Governor Kelly was, what are the public health principles that could be incorporated into the plan? And then the governor is the one that, of course, made the decisions as to the nature of it. And I think some of that was done, and again, I'm not a politician. And I don't have a deep knowledge of legislative affairs. Still a week now since the legislative action of last week, I know there's constitutional questions and there's legal questions. What I provided in our agency was public health principles, and that's what was baked into what eventually came out from her.
So your preference would have been, obviously by what you said, your preference would have been to keep the plan in place as it was and more than guidelines, strictly from a public health standpoint.
Yes.
Dr. Norman, seen some discussion nationally about pneumonia deaths this year, and I'm wondering if you can discuss whether you have any sense of whether that was, we saw more than average in Kansas this year, and if so, if that is potentially attributable to COVID.
It's a good question. The origin of the question, how do you tell a pneumonia death from a COVID-19 death? And what I will say is that, and let me compare it to influenza. Influenza deaths are often because of a secondary bacterial superinfection by usually a staph organism. Those are really hard to separate out. COVID-19 deaths have typically not been complicated by bacterial pneumonia, and if there's a pulmonary illness that is leading or contributing to death in COVID-19 positive patients, it's typically COVID-19. It's apples and cantaloupe by comparison to the bacterial superinfection on top of influenza. It's a good question, but it's really not that confusing with COVID-19.
Has the state seen any cases of this syndrome that popped up, at least in New York, involving children, where they get the rash and... Yes.
And the answer, the pediatric multi-system inflammatory syndrome. And the answer is yes. I know that Children's Mercy Hospital in Missouri has had either 2 or 3 patients, and I believe one of those is from Kansas. So it has come to the Midwest. We know it's also been in St. Louis and Chicago, but I know the folks at Children's Mercy have taken care of kids, and there's not been a death from that yet.
You said that there are some new clusters, Mother's Day, funeral, and a cake party. Can you provide any more detail?
No, I mean, I don't have any more detail to give you right now. The keg party was not one that was on the other side of the state line. I do know that.
Well, you're not referring to the Ozark situation.
Right, I'm saying that the keg party was a Kansas keg party, yeah.
There is a planned protest here at the Capitol tomorrow. I just checked on Facebook. It has 1.6 thousand people either interested in going or going to the event for the Minneapolis shooting death. What do you have to say to people that might come out here tomorrow to rally and protest?
Well, I've said all along that the gatherings of any kind are inherently likely to lead to disease spread. And what I would hope is that people would wear masks and distance. I have a hunch that that probably won't be the case, and I think that gathering in that manner is ill-advised.
You mentioned mental health, Powell. That's a big concern of yours, with the younger generation, with teens, how this has impacted us. And I see on the comments on a lot of articles about reopening, well, good, because the suicides related to people losing their jobs are going up exponentially. And I see those as comments, but I'm wondering if the data actually backs those messages up.
I don't have those data at my fingertips for Kansas, I have to admit. I know the all-cause death is down in the state of Kansas, mostly because of accidents are markedly diminished. I'll have to look at deaths by category, and I'll bring that back at another time. I don't have those data right at my fingertips.
Could you go into a little bit more detail? You talked about, first of all, the source of the data relative to Kansas is 7th in the nation ranking for the virulence of the virus in terms of the infection rate. Can you go into a little bit more of that, and why is it that we're in the top, quartile there?
Good question. Becker's Healthcare who was a publisher.
Who?
Becker's Healthcare is the one who published it. Now they are a service that takes other published information and push it forward. I'll have to get you the actual research citation. It listed the top 14 and the bottom 14. Top meaning the best 14 and the worst 14. What was part 2, Jim?
Well, just go into a little bit more detail as to, our rate is lower than many states, but why is that? I mean, you said we've done a better job of social distancing and so forth. So
yes. The reason for this, right, the reason for this success. And again, I reported earlier in the week that there's 5 states with a lower case fatality rate than Kansas, which means we're better than 45, 44. Yeah. I left my phone in the other room to do that with the calculator function on it. I think it is because of the fact that we're using proven techniques to push down the disease spread. And early school closure, the early stay-at-home orders, and then people, at least a sufficient enough quantity of people are taking the hand washing, mask wearing, et cetera, seriously. And I think we've, driven by, stopped by boxed large stores or things like that. And I think we've seen plenty of instances where people haven't been attentive. But I think there's a large number of people that are attentive. They're still, and I have a lot of acquaintances and I hear from a lot of people that say, if my county opens up more, I'm not going to change my habits until which time I feel safe enough to do that. And while I think that that's good, it also, people self-select because that means they can do that without having economic hardship, child care issues and the like. And so on the one hand, I think it shows really good judgment, but to avoid situations that are inherently unsafe. But the other side of that is, I think we are compelled as employers and as state governments and county governments to really take a hard look at the people that do not have that kind of flexibility, financial or otherwise, that really do need to go back to work. And I think the employer community would, has an obligation, and I think most do feel this, to how can I keep my people as safe as possible?
Let me ask you this question, as a quick follow-up. Let's say I'm working, I'm an essential worker. I'm in a restaurant, I work in a dentist's office, I work in someplace else that is reopening. And I have concerns that my employer is not following guidelines and that I'm at risk. Who do I call? What do I do?
Yeah, that's a tough one, Jim. Well, we always are willing to consult with businesses. I mean, the CDC has guidelines, and we have guidelines as to how we can advise, like we've done with the meatpacking plants and others. How can we help you be the safest environment possible? Our website has all sorts of sector-specific advice on how to make places as safe as possible. I think where it gets really tough is when a person says, my job is there waiting for me, but I don't feel safe going back. Matter of fact, it was a week ago, I don't think I shared this, I got an email from somebody I've never met, and he has an immune deficiency syndrome of some sort, and his 22-year-old son lives with him, and his son was reluctant to go back to his place of employment, which is a restaurant. Because he said, Dad, I don't want, and there's just the two of them that live in the household. And he said, I don't think I can safely socially distance. It's a small house, and we live together. And but my job is being not only offered to me, but I'm expected to be back. And so I saw the guy's had his phone number. I just picked it up and called, and I said, I understand that your son is really, he sounded like a nice guy, worried about his dad. And he said, yeah. And I said, well, what, is your son there? He said, no, he's out doing something. But I said, has he tried negotiating with and just say, tell him I'm concerned about my dad. Will you hold my job for me? And he went back and he said, yeah, we'll hold your job for you. Still, you can stay home a little bit longer. And he said, it's not about unemployment because my dad offers a house to stay in. And I feel, so I think that's a good place to start. Sir?
Yeah, Dr. Norman, yesterday you appeared on the KDHE Hospital video conference,
Yep.
and there you had mentioned that reference to you have statutory authority to close businesses that are practicing unsafe public health practices. Is it your intention to police businesses across the state in any way and to shut any down going forward?
Right. The question was, I have statutory authority to shut businesses or close gatherings, and the answer is absolutely not. Would I be willing to do that if I thought that people were in peril? And judging on the gathering itself, the setting, the community, the county, et cetera, then I do have the authority to do that. I don't always much rather, and I have spent some time particularly on weekends, with county commissioners and health officers on just that exact topic of kind of saying, let me bring additional set of optics to this discussion. And fortunately, it has not been required to have a mandatory closure order from me yet. And I would not want to.
I guess on that or not, if do the last question. How much does it matter the states around us? Why is it important to have a low number of infectious rate within the state? I mean, people could be coming in and out and everything.
Right.
How could that number go up?
It can go up by being careless, because it's not zero. There's not zero people infected first. And there's always going to be people coming into and leaving the state. I had no idea how much people move around until Lake Perry had 3 states involved. That first week of May, the kind of party cove kind of lashing together of boats, et cetera. Umpteen counties and 3 states. And so there's a lot of mixing across state borders. And I'll tell you what, some of our surrounding states are not as fortunate as we are, and some have fully twice the number of cases and twice the number of deaths that we do, and the same size population. So we have to be vigilant, and we just have to keep doing what we're doing because it's working. Thank you guys very much.
Have we found out whether any cases were at that Lake of the Taking card and I'm parked next to you, so I'll start. Oh, that was the other question. I was at Walmart.
Sean, just a second to put my TV down. I'll just go to the TV grid.